See how this works.
It says we're live.
Amy was just we're live. Amy sent me a text message like, "Where's Jennifer?" Oh my god, I didn't
Glitches, lots of glitches.
working on it. So it says we're live. Like I don't have to click go live. If you can see me, oh no, let me see. Oh, you can play games together. It says we're live. Let's say no comments yet. If you are, yes, I see a one by the eyeball. Okay, so to be sure that you can see us and that we did this right, because this is our first time using Facebook Go Live with other feature, at least mine. So say something in the comments so I know that you can see me. Make sure we're not the two. I think we're good now. But after about a half hour delay, here we are with Miss Jennifer Yaeger. She is a counselor based in Georgia. Oh, can't see who? Can't see me?
Uh-oh.
Which way? Oh, and you sound real quiet.
Can you hear me?
You sound real quiet.
Okay, hang on. Let me see. Let's see what we can do here. Um,
Oh, he said he can see you.
okay, good.
But you do sound quiet to me.
So all I can see is you. I don't see, and it says live. I don't see any comments. I don't see anything else but you. So
Yeah, well, I just had one comment. We have one comment. It's in like right by my picture on the
okay.
right, on this side. You can't see where Corey Emler says, I can see you.
Mm-mm.
Okay, well, I'll tell you what they said.
Great.
I'll work. So, okay, so thank you for, you know, staying with us. We were trying to figure something out, but we got it and we're working now. So, um, I'm going to let you, this is about chronic illness and mental health. And everybody, we got a little heart. Did you see the heart? Did
No,
you
I
see
see
it?
nothing. I see
And you're
nothing.
still very quiet. I
Oh, and
wonder
I'm
if it's
such a loud person. I don't know how that is
me
possible.
too. No,
Oh,
that's how
I
you
can.
mute the microphone. Let's see.
I don't
Can you
know.
just crank it up, maybe? Your
It's all the way
volume?
up. Yeah, my volume
Oh,
is all the way
really?
up. Yeah, I
Let's
can
see
put
if
in
I
my
can do
AirPods.
mine. Can you hear Jennifer when she speaks? Can you let us know? Say
Yeah,
A
let
B
us
C
know.
D.
I can put in my AirPods if that would help because I don't know if my.
Maybe.
All right, let
Can you
me grab
guys
them real
hear
quick.
her like that? Can you hear me? Probably so, because everybody's responding. She's going to try putting in her earbuds and see if that helps a little bit with the audio.
Oh, you got loud. Can you hear? Is that any better?
I'm loud
Not bad.
though.
Well, I'm turning you down right now, but is that any better for me?
Oh, okay. Corey says he can hear both of us loud and clear.
Okay.
And Cheryl is suggesting that maybe you get closer.
Oh, I can get closer.
Come here,
I'll
baby.
try that. Yeah, here I am.
Yeah.
All up in
So,
your face.
all right. Well, thank you for doing this. I really do appreciate it.
My pleasure.
So, tell us more about you and your career. Start there.
Okay, sure. My name is Jennifer Yaeger, like Andrina said, and I have been a therapist for almost 20 years. And I have most of my career has been in Mississippi and in Georgia. And I have actually spent a lot of my career in pretty much all aspects of mental health care. I've worked inpatient, I've worked intensive outpatient programs and created a few, and been the director of one. And I have had a private practice for over, I think close to maybe 10, between 10 and 15 years. And now I have my
Mm,
own practice, and I'm a supervisor. So I have 10 therapists who work underneath me at my place and Seaglass Therapy, which is in Newnan, Georgia. And I tend to specialize in women's issues. I always have. I do see men as well, and I do see couples. But I really am a more of a trauma specialist. And so when we think about the concept of chronic illness, that absolutely falls underneath the category of trauma. And most people wouldn't even necessarily consider that, but it is once you start to think about it. So I think that's
Yeah.
probably how I started seeing women with chronic illness, not intentionally, but it just started happening because I do a lot of trauma work. So that's kind of how I got
Mm.
into it. And I do personally utilize a lot of alternative methods. So I am trained to offer trauma informed yoga. I do a lot of expressive art therapy, um, that is trauma informed. I do EMDR, which is a specific kind of therapy for trauma. So we do a lot of somatic or in the body work, and we do a lot of the expressive art therapy and utilize drums and utilize all kinds of different modalities. That's not just talk therapy because it really reaches a lot of other levels that talk therapy doesn't quite get to.
That sounds a lot more fun than any therapy that I have been in.
Possibly. Very possible, yes. Although if you
Yeah,
ask some of my clients when I tell them to draw, they will glare at me wholeheartedly. So it sounds fun
I love
until, it just depends.
Yeah, well, it's always uncomfortable talking about your emotions, even if you're expressing them through an alternative medium.
Absolutely. Absolutely.
Yeah.
Speaking of doing more than just talk therapy and speaking of treatment of chronic illness, one of the
Hmm.
things that has become very popular is something called spoon therapy. Have you heard of it? Are you familiar with it?
When you count your spoons?
Yes.
No, what are you
Do
talking
you know a
about?
little bit what I'm talking?
Okay,
Well,
okay, okay,
yeah,
yeah.
you do actually. Okay, so the concept behind it is that once a therapist who had no idea it was going to catch on like it did, but it's really a brilliant way to do this, and people with chronic illness love this and feel so validated by utilizing this modality. It's very simple. All it is you get a whole bunch of spoons in front of you, and you take one spoon away for every limitation that your illness is giving you in that moment, right? And it can
Hmm.
be a daily thing that people can practice, but the validation that gives to give something that's invisible, that is happening a lot of times internally that nobody else can see, right? You're the only
Hmm.
person experiencing that. And so a lot of times what I find is that people really just question themselves, and they will always do the thing where somebody else has always got it worse. And my
Hmm.
answer to that every time is yes, you're right. There are always people who have it worse, but there are also always people who have it better than you do, quite frankly. And so
Hmm.
none of it really matters. What matters is your experience and your spoons in front of you. So the
Hmm.
concept is you take a spoon away for every limitation that you're experiencing, let's say on one day, and you can see right in front of you a tangible evidence of what's going on invisibly inside and what you're left with. And
Hmm.
typically, you measure it kind of in terms of energy, right? And so you may have a good day where there's only a couple of spoons that have been set to the side, and look at all the spoons you've got left. And so those are your more productive days where you really get some great stuff done. But you may have a day
Hmm.
where all your spoons are gone by noon. And then what
Yeah.
do? You allow yourself to rest, you know?
I've seen memes that kind of reference that, but I never knew that you actually use the spoons as like a visual of what's going on. Like they say, taking a shower, one spoon, going to the grocery store, it might be two spoons, and you take them away.
Yes.
So
And,
that's
obviously,
interesting.
isn't that cool? It's, I mean,
Hmm.
it can relate to more than just chronic illness, but especially for somebody who suffers from chronic
Hmm.
illness. Yes, going to the grocery store may take 4 spoons some days, right?
Yeah.
Whereas the average person may only utilize one. Whereas,
Hmm.
a mother with an infant and a toddler and a 4-year-old might take two, So, I
Yeah,
mean,
especially if they're coming with you.
right, that's what I meant. Yeah. So, and you're not using ClickList. So I just think that anything we can do that is more of a tangible evidence of what we're experiencing on the inside, gives validation, and also then can give understanding to the people in our lives, which, as you know, that if you're somebody who struggles with chronic illness, a support system is everything. It is
Hmm.
everything. But you've got these people around you who, if they don't suffer from one themselves, they don't get it. How could they?
Hmm.
It's your unique experience. So anything you can do that helps them understand on a deeper level what you're experiencing and what you're going through, then it creates more connection between the two of you, but also can help your world, right? The more they understand what you're suffering from.
So, what would you say to someone who doesn't have the support of their close loved ones or family?
So it's interesting you asked that. It is a slip. My answer is this is a slippery slope, what I'm about to say. And anyone who's ever struggled with anything on the face of the planet, especially in the last year, has probably had a similar experience, quite frankly. But
Hmm.
I always say go looking for a support group that's filled with people just like you. Except, by the way, when you do that, remember they're just human beings just like you, and there's no therapist in there moderating a support group
Hmm.
by and large, which means all the things you can think it means. So I have clients who have chronic illness who will go looking for that. And at first, a lot of times it's wonderful. And then they'll have days when they come in and they're like, I had to get off that. All I read was
Hmm.
doom and gloom. All I read was the negativity, you know. And then sometimes it will buoy you up and sometimes it will feel like it pushes you down. So it is a slippery slope, but ultimately being understood, you know, on that deeper level is just invaluable. I mean, it really is.
Like
And so if
having
you
that
can
empathy
find,
from.
absolutely, absolutely, you know, that's the
Hmm.
whole premise that it's one of the things that makes AA successful, right? Alcoholics Anonymous is successful because it's a room full of people who get each other and don't shame
That's
each other
shared.
and don't
Hmm.
and don't say like, can't you just get up and make the best of your day when you're in constant pain? You know, I mean, it's
Right.
that deeper level of being understood that is vital. So I usually recommend that people try it, and you know, not all the groups are great. That is true. And sometimes you may get in a group and the group itself is not that great, but maybe you've made a connection with one person in there that you can keep
Mm.
going or
Yeah.
anything like that, you know.
Yeah. You see a lot of positive and negative things within the groups. A lot of it is positive, or they're trying to find out, like, what is this? You know, I guess if they're having to wait to see the doctor, they're like, okay, let me see. Sometimes they do get the answer before they actually
Yeah,
see their professionals, like their
absolutely.
PCP. Hmm.
Absolutely.
So, what would you tell someone who is grieving their old self?
So it's really a re-identification process, right? I mean, the when
Hmm.
you get a diagnosis, and really at any age, I have a client actually who had been born with her chronic illness, but did not know it. It's one of the more rare ones, and had all these bizarre symptoms her whole life, and then did not find out until she was already my client. Finally saw the doctor
Mm.
who was like, here's the label, here's what it is. And you know, it was really interesting because you know, like at first, she was so relieved. She was so elated. I'm not crazy. All these symptoms, everybody's looked at me like I'm bizarre, you know, but you finally get the pieces together and there's relief. And then there was still immediate grief of what does this mean? Now that this is my label now, who am
Hmm.
I now? You know, even though nothing had even changed in her, you know, except for having a name for it. And that
Yeah.
alone, you know, kicked off the grief process. So, you know, when you're grieving the old life, then you do think about those traditional 5 stages that we've always heard about. And there have been a million memes and a million funny cartoons
Hmm.
about it and referenced in everything, every movie ever. But they are legitimate. Now, that people, we've kind of reimagined them just a little bit, not the way they traditionally used to be perceived. It used to be that you thought you went from 1 to 2 to 3 to 4 to 5, right? And we don't see it that way today. We see it more along the lines of more 3 stages of grief, but it's all 5 parts. So stage 1 is still
Hmm.
always going to be that denial and that shock that our brain protects us from that immediate knowledge that
Hmm.
otherwise would just knock us down. And
Right.
so there's kind of an easing into this is my new reality. And then there's the working, I call it the working through part, which has what we've traditionally called steps 2, 3, and 4. And that's the emotional working through. And we've got sadness, we have anger, understandably so. The third part that people, I mean, I'll be honest, whoever came up with the name for this, and I forgot her name right now, but it's a little misleading because it's bargaining, but it's not really. What it
Mm.
really is it's the if onlys, and it's the regrets, right? If only I had done this before I got this illness. If only I had,
Yeah,
like, or
I
what if
do
I'd gone to
that
the
a
doctor
lot.
sooner, right? Yeah. I mean,
Yeah,
did I
like I
miss my
wish I could have
chance?
done, like if I would have known I was gonna have sarcoidosis at the age of 23, I would have done this and this and this. But
Yes.
there's no way I could have known.
There is no way. And so a lot of times though, so say you might have had this experience if you ever shared that with someone, like you're just kind of you're in that grief moment and you're like, man, if I had known this was going to happen, I would have gone backpacking in Europe, right? Changed
Hmm.
my mind. And then what's the first response that your loved one comes back with? It's always something like, well, you couldn't have known, Andrina, or you
Yeah,
can still go, or, it's
yeah.
something. And it's whatever it is, they are attempting, as much as they love you, to lessen your pain. But what our job is when you're the one grieving is to actually let that thought go to the nth degree. You play it out, right? And you go, well, what if I had? Or, I mean, what would have happened? What would it be like? Because what ends up happening is your brain works through the channels of all the if onlys and the regrets. You come to the same result every time, right? If only I'd gone to the doctor sooner, you'd still have the illness, right? Like it would
Hmm.
have still happened. If only I had
Hmm.
gone and done this thing on my bucket list. Okay, but you would still have the illness. Your brain has to work it through to get to that result. And that's
Hmm.
part of what moves you through the grieving process. So you really have to let your brain go to those places and ask those questions that don't even make sense and are illogical or whatever, and you
Hmm.
play it out. And then the final
Oh,
stage
that's
is
good to
acceptance in
know.
theory. Yeah, the
That's
final stage is
interesting.
acceptance, but I will say this. Yeah.
Yeah, because a lot of times you stop yourself, like you just said, oh, how could you have known? You could still do it. And I usually stop myself there. I've never really allowed myself to continue that thought and be like one thing is like I wish I would have had kids before I got sick. It's like I think what would it have been like to be in my early 20s with a kid? And uh,
And sick.
when I think about that, I'm like, ooh, I don't
Yeah.
know if I would have wanted that.
I mean, I didn't have kids in my early 20s, so I would not have wanted that
Yeah, I
either.
wasn't ready.
Yeah, but I mean, but that is a significant thing you do have to grieve. Like, yeah, but then I didn't
Hmm.
get to choose, and so it's kind of
Hmm.
thinking through that. But again, when you allow yourself to do that, then you let the emotions that come with it, right? You actually let them pour forth. And, our job in terms of dealing with emotions is just to let them be. We try to fight them, we try to rationalize them, we try to sniff them back up or tissue them away or calm them down, but that is not
Hmm.
our responsibility. Our responsibility is to actually let them out in a safe manner that keeps us safe, that keeps other people safe, but
Hmm.
truly expresses them as much as possible, because then we move through them and we move on. And so that last level of grief being acceptance, I just want to say that acceptance means many things, and it's obviously the goal, but you don't always stay there, and that's okay, because there's new things to grieve sometimes at different stages.
Hmm.
Yeah.
That's good. That's very insightful. So we have a question from someone you may know.
Okay.
Her name's Amy. Can you talk about navigating family relationships around your illness? If they say things like, well, at least you can work, or, well, you look good.
So helpful. Isn't that so helpful when they say those things? Not at all. I think that when talking to your loved ones, we have to be very clear, right? And we have to express our needs. And so people don't know what to say. People say the worst things with the best intentions. I may be a
Hmm.
therapist, but in my personal life, I have been that bumbling person who has said everything wrong at a friend's loss. Like, I mean,
Hmm.
I have been there. I've done that when I know logically what to say, but in that moment, their good intentions often are at our expense and bring us pain. And so it is, I would say, our responsibility to inform them. Like, when you say that, it is hurtful to me. It is not helpful. And I know you're trying to be helpful. Here's what you can say that is helpful, Or by the way,
Mhm.
just don't say anything, just walk down this path with me. I mean, in
Mhm.
terms of grieving, that's what we're supposed to do anyway in the face of loss. Nobody can change that loss. Nobody can change your reality. You just want them there with you, walking the new path.
So you pretty much need to know what you want from them and, instead of just what you don't want, and then be able to ask
Yes,
them for it.
absolutely. And that part's the tricky part. I can't tell you
Mhm.
how many glazed over eyes and blank faces I get when I look at largely women and say, "What do you need?" And they blink. I don't know. I don't ask myself that question. Nobody asks me that. But it's probably the most important question that any of us could ever ask ourselves. And so we need to be constantly doing a deep dive internally to figure out what that is.
All right. So feel free, everyone, if you have a question that you would like to ask Miss Yeager, we will share that. So let me ask about I've had therapy on and off in different stages of my life. I'm currently taking an antidepressant, but
Mm.
I don't have therapy. So, how do you feel about medications versus actual therapy? Is
So
it something you have to do together?
not always. I mean, it's truly an individualistic thing. There are times when some clients I'll recommend to go ahead and go get on some medication if I see a need. And there are some clients who come in already on medication, and there's some clients who never need it. It is completely personalized and individual. I would say that usually you can recognize a need for it when they theoretically you have found yourself stuck in a pattern of slight immobility for over 2 to 4 weeks and nothing's changing and nothing's giving, especially if you're already in therapy and yet you're really stuck, and it's just there needs to be. Now sometimes you can have a therapeutic breakthrough, right? Sometimes that can happen.
Hmm.
Sometimes I discover that, or well, more often than not, actually, no, maybe not that, but about half the time I've discovered that a lot of my clients are are drinking too much when that happens, which is a depressant. And so
Hmm.
I've noticed that they're stuck, even though logically they're like doing the work and they should be making some progress. And we're
Hmm.
humans, and we self-medicate, right? But a lot of times when we try
Hmm.
to do that, we do it in the wrong direction. And so I'll discover that, like, their occasional glass of wine has now turned into a nightly bottle, or nightly 3 glasses, and I'm like, oh, okay, and so it's one thing at a time, and we've got to take away that depressant first and then see, is there a need for a medication possibly next? But it's always an option, and sometimes it works beautifully together, and sometimes it's just not needed. It just depends.
Zaya, I hope I'm saying his or her name right. What about building new relationships when you're chronically ill and maybe a little bit depressed?
Absolutely.
Yeah.
Especially because you're right. So first of all, can you even get the motivation to do so? Right.
Hmm.
Secondly, I get this question a lot, especially if you're dating. At what point do you drop the bomb? By the way, I've got this life-changing illness that you should probably know about. I mean,
Hmm.
that's a hard question. Or even in friendships, because how do you know if someone is equipped to deal with that information well, or at least not
Hmm.
really badly? Because people are people and we all have limitations. And
Hmm.
so with friends, potential friendships, I personally always tell my clients to do this method called using floaters. And so you drop out little tidbits of information that is slightly sensitive but would not break your heart if they respond poorly, right? And you see what they do with that. And you kind of go with your gut in terms of their response, but in general I say, like, if you say something slightly vulnerable to someone and they immediately draw near to you and they kind of draw in, and then the inclination is they share something. then you're like,
Mm-hmm.
okay, this person could be a safe person for me, you know? And if it's about
Mm-hmm.
your chronic illness, then it can be something like that, like trying to think of an example, but depending on what the chronic illness is and the symptoms that go along with it, you could drop one symptom and just be like, oh yeah, I kind of
Yeah, I
struggle,
was trying to think
like
of a way that I could do that about telling someone about my sarcoidosis. And I was trying to think what would be a small thing like that you could say that would, be a little bit sensitive, but not too telling. And it's hard to think like what is something that I could say that wouldn't be like, well, I've got to go get my infusion today. That's pretty dramatic, right? Like they'd be like,
it
oh,
is. I mean, that's a good point. I mean, you could, make that passing comment like, oh, well, I'm no stranger to a doctor's office, and just see what happens
okay,
there. I
okay, I
mean,
like
what if
that.
what if you have somebody who doesn't believe in Western medicine at all by chance, and you didn't know that, and they said they're like,
Mm,
oh, I never go to the doctor's office. I don't, and you're like, okay, I'm gonna mentally stack that away. I mean, so even
yeah.
something as mild as that, or there's so many people out there. I guess this is an example. There's so many people out there with IBD or irritable bowel disease, right? So either Crohn's or ulcerative colitis. And
Hmm.
those are really embarrassing diseases. But there's so many
Hmm.
people that struggle with that. Although you'll hear people throw around the term IBS, like, oh, I've got IBS. Like people will say that kind of flippantly, right? So it could be
Hmm.
something like that. Like you may not drop like, yeah, I've got a debilitating bowel disease. You may not say that, but you might be like, oh yeah, IBS, I understand that. I mean, it could be, you know what
Hmm.
I mean? It can be something that you just kind of dream up, and it's, you use your little personality flair in there.
So since my diagnosis, I was had left home, and now that I'm back, and I'm different now. Like I use a walker, and I'm like 100 pounds bigger. So I hate running into people who knew me before. I rather them keep that image of
Yes,
me, and I don't like them for to see me now. So it makes it real hard to I like new relationships more because at least they can see me like how I am now, and that's their only reference.
that is such a
But
good point.
yeah.
I mean, that's something, Andrina, when I think about, one of the bigger issues you have to deal with in therapy, that's definitely one of them, right? Because
Hmm.
there is a level of, unfortunately, while we can say all day, like, why would that be embarrassing? Because we're just humans and you didn't do anything wrong to cause this or whatever. It
Right.
doesn't matter. You feel it. Like, I mean, you're
Hmm.
human and you feel it. And what do you do with that? How do you manage that? How do you get into a habit of leaving your house and not feeling paranoid that you're going to run into somebody and have to explain or feel embarrassed about having a walker, and there, I
Yeah.
mean, and how do you answer the questions? Now, I will say, so, you know, the term boundaries is a real common term out there in my field and even, in popular vernacular, I would say. But a lot of times people don't know how to enact them accurately. This would definitely be one of
Hmm.
those areas where boundaries come in, and my favorite way to use boundaries, quite frankly, and that is the pat answer. And the pat answer is something that you come up with ahead of time, and it is locked and loaded, right? So when somebody sees you from your old life with a walker and they go, are you okay? What happened? And you're like, I'm
Yeah.
not really fixing to tell you all my business. You have a
Hmm.
one sentence answer that you feel very confident about saying, and then you say it repeatedly. And that's what sets up a good boundary so that you feel protected and you don't feel vulnerable to being sideswiped and feeling like you
Yeah.
have to explain all the details,
Yeah. Because when people ask me that, and I'm like, I need to come up with that one sentence response because you typically I'll say like I have neurosarcoidosis, and that leads to what's
And they're
that?
like, what?
So I'm like, I have a disease that's a lot like MS. It's typically what I say.
Hmm.
So
And if you feel
making more people know about MS.
they do, and if you feel comfortable saying that, then just say that.
Hmm.
You don't even have
Hmm.
to give it a name. they're not going to remember it. I mean, like you can just say like, well, unfortunately, I struggle with a disease like MS, and you can leave it at that because nobody's going to, most likely they're not going to ask you much past that because they don't know what to ask you.
Yeah,
So that's a great answer.
thanks. So a lot of people are sharing about how they use therapy and medication for
Mm.
depression and anxiety. How do you deal with adult children and their denial that you are chronically ill? My mother was like that. She's like, there ain't no such thing as sarcoidosis. Like, I ain't never heard of that.
So it must not
So,
exist, right? Uh,
right, exactly. Like, because she knows everything, right? But yeah, I understand that probably because I don't want to believe that, you know?
of
But
course.
what would you say?
That is an excellent question. So again, this goes back to the needs. And like it really kind of goes back to people just reacting and sort of insensitive comments and they don't realize it. And when you've got adult children who are not accepting that their parent has got a debilitating illness, I mean, it's clearly their issues, right? And they need to work through
Mm-hmm.
those. But you need to be able to set boundaries so it doesn't hurt you. And so you probably have to have that conversation, that sit down other time conversation, not in the moment necessarily if they're being like right then, but saying like, look, I have this, whether you're able to accept this or not, this is my reality. And every time you deny it, it is painful to me. And
Mm-hmm.
I love you. And, I'm okay. And especially with adult children, because they're your children. You always reassure children, no matter how old they are, I am okay. You don't have to worry
Mm-hmm.
about me. I'm a little concerned about you and your denial, by the way. So go get some therapy for that. But still to just have that
Yeah, because they're going
conversation,
through their own
you
grief.
know,
Like they're losing the mom they thought they had. Like
absolutely.
they have to go through all the
Absolutely.
stages too, and they might be in that denial phase.
Yes.
Wow.
Yes.
So, what do you feel about children who are living with a chronic illness? And because I had spoke to a 16-year-old girl. Well, I did like virtually. I spoke to her father too, and her story really touched me because she was diagnosed with sarcoidosis when she was 3 months old. So she's kind of, and then another girl that's going to be on our documentary, she was 4 when she started having symptoms and 6 when they diagnosed her. I kind of want to, hook them up, like so they can talk to each other. But
Yeah.
what would you say to a child like that? Because they both are doing well, but there's that part of them that kind of worry, like, what's my future going to be like? I'm not like the other kids. Like, what would you say?
Absolutely. Early intervention therapy is just the best answer, as well as occupational therapy. That's a piece that's not always entered into, but I mean, I told you earlier, like I'm a somatic therapist, so which means I just focus on the body as well. And one of the things you have to deal with when you have a chronic illness is the feeling of betrayal of your body, right? And so there
Mm,
can be a great disconnect of I'm up here and this is down here, and even and a feeling of betrayal of this part of you, and a feeling of sometimes hatred of this part of you, and it's a whole nother thing. And so what you've got to do is then reestablish the connection between the mind, body, and spirit, and really on a deeper level increase the feeling of safety in a body that for all practical purposes has betrayed you to some extent. And so
hmm
that's some deeper therapy work, right? I mean, like that's
So
not
you would recommend, like, their parents might not think that maybe my child needs to be in therapy because maybe it's well managed or something, but do
sure.
you think it would be good for a parent of a child with a chronic illness to go ahead and put them in therapy anyways, just to ensure that they,
Absolutely. Absolutely. That and the parent needs therapy because think about
yeah, because
being
that's their
the
baby,
parent.
yeah.
Whew, yeah. So, I mean, everybody needs therapy. I mean, everybody needs therapy. Like
I
everybody
think
does.
everyone can benefit from therapy. Nobody's got it
Absolutely.
together so much.
No,
Yeah.
they do not. They don't.
But
But
there's such a stigma around
definitely,
it.
I know. And I don't know if it'll ever end. I don't know if it'll ever end. I would like to be hopeful, but I don't
Yeah.
know. But yeah, I mean, I think all children could benefit from a lot more therapeutic interventions to be taught even in I mean, I wish they were taught in schools. I wish, there's so many things
Hmm.
I wish.
It
But
should be.
definitely the level of anxiety that a child with a chronic illness feels. On one hand, it's for those that have had it, especially like the two that you referenced, their entire lives they can remember. It's all they've ever
Hmm.
known. That is their
Hmm.
only identity. That's their only memory. And yet, there's still the grieving process of not being a typical child, right? And then there's still the anxiety of what does this mean, because they have a child's developmental level as opposed to our adult brain that we can get there a lot faster. And children, it's a working through process. And, you can't expect a parent who is also traumatized by their child's
Hmm.
diagnosis to be able to always be that perfect support for their child. That it takes a little bit off the parent as well for a therapist to be involved.
Yeah. And as you know, a lot of people have good intentions, but that's not a job that most people are equipped for, you know?
Yeah, yeah.
Yeah. So what would you say to someone who is feeling suicidal because of their chronic illness, or maybe not quite that stage, but feeling like they might be heading towards contemplating something like that?
Yeah, just having the thoughts. The first
Mm.
thing I would say is that I don't really know if there's many people who make it to a certain age without having the thought cross their mind at some point, because life is hard. Like, so let's just
Mhm.
acknowledge and let's normalize suicidal ideation to some extent. Um,
Mhm.
but definitely there are levels, right? There are levels of fleeting thoughts versus little starting to toy with the idea. And of course, if you have a chronic illness, well, that puts you in a whole nother category of how do I deal with my life? How do I deal? I mean, if you're somebody with chronic pain, I mean, of course they are going to struggle with suicidal ideation. Again, I mean, they have to have their own therapist so that they can really process through that. There are obviously numerous suicide hotlines out there and crisis lines. The only thing I do want to say about those, while I am so grateful they're there and I'm so glad they're there and they really do serve a purpose, they're not the end all be all, and it's just it's a in that moment crisis step that people can take, but
Mhm.
ultimately there's got to be ongoing therapy if they find their thoughts go in that direction.
Mhm. So we're gonna give you a few more minutes if you'd like to ask some questions. I've had you now for about 40 minutes, and it does not feel like that. Doesn't feel like it's been 40 minutes, does it?
No.
This has been really fun. So, if you have any questions you would like to ask, go ahead and ask, please. If not, we're going to let Miss Yaeger enjoy the. Ooh, okay, I see more that I scroll down. Okay, yeah. So I'm going to allow you to enjoy the rest of your weekend. I really enjoyed this conversation.
Me too.
Like,
You
I
asked
want to
great
go see
questions.
you. If I was in Georgia, I would have like signed
Thank
me
you.
up. Yeah,
Thank
and
you.
just a
Thank
little
you.
behind the scenes information. I actually did meet Jennifer when I was in Georgia, and I was very sleepy at the time, so we didn't get to talk much. But I was there.
You were there.
All right, but it's been great chatting with you, and I would love
You too.
to talk to you again sometime.
I'm up for it. Thank you so much,
All
Andrina, for
right,
this
we're now
opportunity.
friends on Facebook, so at least we have that.
Yes, absolutely.
All right.
Absolutely.
Thank you, everyone, for joining. Everybody saying thank you. You have a good
Thank
night.
you. You too. Bye bye.
Thanks.